Hi, Mr. Jackson. My name is Drayton. I'm a student nurse. I'm just coming in to clean your trach. Is that okay with you? Okay, great. So now before I start, I'm gonna go ahead and do a respiratory assessment on you. I'm gonna raise the bed up so it's a good working height for me. And then now when I put my stethoscope down, you're gonna take a deep breath in. Now with a regular respiratory assessment, I would listen to the 4 quadrants on the front and 4 quadrants on the back. But because I'm the only person here and I can't really lift Mr. Jackson up, I'm just gonna listen to the front. All right, Mr. Jackson, your lungs sound good since we suctioned you earlier. To start, I'm gonna go ahead and turn up your oxygen, hyperoxygenate you. And I'm gonna go get the rest of my supplies. Being careful not to break sterility. Go. So I'm gonna go ahead and put some saline in the basin. I'm gonna go ahead and take out the inner cannula, being careful not to touch the inner cannula to anything. I'm gonna go ahead and put it carefully in the basin. Put my gloves off. Now I'm gonna go and put my sterile gloves on. Okay, now I'm sterile. Cleaning the inner cannula away from my sterile field. All right, I'm gonna rinse it off. I'm gonna toss the brush, and I'm gonna replace the inner cannula. All right, I'm no longer sterile. I'm gonna go ahead and clean the stoma, dipping into my clean solution. I'm gonna take off the old gauze, straight to the trash. Clean around the stoma. I'm gonna inspect the stoma for any signs of infection. There are none. Straight to the trash. I'm gonna grab another one of these and I'm gonna dry off around the stoma. We don't wanna leave any moisture behind. Straight to the trash. And then now, I'm gonna go ahead and grab my trach tie. I'm gonna replace it. And I'm not gonna take off the old one until the new one is fastened in place. taking off the old one now that the new one's fastened in place, and we're gonna toss this one. And then now I'm gonna take a new gauze, new dressing, and place it around the stoma. Here we go, wonderful. Great, and now Mr. Jackson's trach has been cleaned. I'm gonna take off my dirty gloves, do some hand hygiene, and I'm gonna listen to him again. Okay, Mr. Jackson, so when I place my stethoscope down, you're gonna take a deep breath in. All right, you still sound great. Now normally, again, I would do a full respiratory assessment, 4 quadrants, 2 quadrants on the side, 4 quadrants on the back, but I'm alone and the mannequins are a little heavy. So I'm gonna turn the oxygen back to normal. I'm gonna lower his bed. Mr. Jackson, do you wanna sit up or do you wanna lay back down? Okay, you wanna sit up? Sounds good. So here's your call light. Do you need anything else before I leave? Okay, great. I'll just let you get some sleep. I'd go ahead and clean up my supplies, and then I would document the color of the sputum, what the stoma looked like, the procedure that I just did, and how well he tolerated it. And that's it.